My name is McKenna Greene. I'm a physician assistant in pediatric cardiology at Prisma Health. So I'm from Lexington, South Carolina. I went to USC for undergraduate, and I went to USC for physician assistant school. So I'm a true Gamecock, and now I'm here in Prisma Health in Columbia. So the pediatric population can have a lot to do with cardiology in terms of they can have congenital defects or something that they're born with that isn't working quite right, or they can have things that they acquire, such as POTS, which is what I'm subspecializing in. And where they faint and they get dizzy. So a lot of teenagers can have cardiac issues as well. And we treat that and we make them feel better so that we can watch them grow and flourish into young adults. POTS is postural orthostatic tachycardia syndrome, and it falls under this big umbrella of dysautonomia. And all that is basically the child has a healthy heart and a healthy brain, but they don't communicate very well. And so we, as pediatric cardiology PAs or MDs, whoever chooses to study it, we go into their diagnosis with an open mind and find out what bothers them the most, their most bothersome symptom, what their day-to-day life looks like, and we can treat it with lifestyle changes. And if those don't work, we can really work on some medical treatments to pretty much eliminate their symptoms and let them flourish. So I wanted to go into pediatric cardiology because I've always wanted to go into pediatrics because I love the idea that you can watch someone grow from the day they're born until they're 20 years old. And cardiology really spoke to me because I realized that a lot of teenagers are struggling with dysautonomia and POTS and mental health, and obviously that affects everything. It affects their daily life. So I wanted to be a person that can help them get through that and beat it and live to tell the tale. And maybe one day I will influence a patient of my own to become a PA and do the same. I educate and encourage my patients and their parents to advocate for themselves and really do what's best for their bodies. So whether that's exercising every day, eating healthy, or sometimes it really does come to medication, but just teaching them the knowledge behind it, not just prescribing them a medication or telling them to go on a run. You have to really explain the physiology and why that's helpful and why it's going to benefit them in the long run. I'm a big nerd. I love to read. I read the second I get home to when I go to bed. I really do like to go on walks, though. We have a dog and walk him when it's not 100 degrees outside. But yeah, a lot of reading, walking, hanging out with friends, still relatively young, so hanging out in Columbia. To make an appointment with me, please call the number on the screen.